Most of you all have seen the picture of the coronavirus, isn't it? It's a round circle and it has lots of spikes on it. The whole circle has spikes. That's the imagery of the virus. So you think this is the only coronavirus? This is not the first coronavirus. This is coronavirus number 7. Coronavirus before one was called SARS. SARS, severe acute respiratory syndrome. Another one was called Mediterranean, MERS, respiratory syndrome. So the coronavirus is not the first coronavirus. It is the 7th one. And I am telling you today, there will be more coronaviruses. Why? Before I go on to what it causes. Why? Because we are destroying the planet. Coronavirus is started in Wuhan, in China, when wild animals were eaten. And there will be more wild animals. Why? Because we are destroying the habitat of where the animals usually roam. So more and more wild animals are coming out, and more different viruses will be coming out that we were not accustomed to. And the more we burn the forests, well, of course, the Australian forest was not burned intentionally, but in Brazil, where the forests are burnt intentionally so that people can use the cheap land for farming. You see, it's all money. It all, coronaviruses and SARS and all this, basically come down to money. But you see where they're originating from? They're almost all originating from China. Because this coronavirus is known as a transmitting from animal to man. It's called zoonotic transformation. Zoonotic means it goes from animal to man. And because it goes from animal to man, it's difficult to eradicate. You see, bird flu went from bird to bird. That's how it's transmitted. Bird to bird, and then you eat the bird. In the farms where they grow proper bird, there's no bird flu. But the bird flu comes from the wild birds. When they come into you, where they normally don't leave their habitat. But when their habitat is destroyed, they'll have to come and look for food somewhere else. And where they come? They come where we are. The coronavirus, with the spikes, you know what it does? The spikes, pierces the cells. And it pierces the cells of your body. It pierces the cell of your body. And when it pierces the cell of your body, the virus goes in. When a person coughs, it goes on somebody's hand first. Please remember this. It goes, you don't go to your face right away, no. You get it on your hand first. This is most important to remember. Then you take that hand and you what? You wipe your nose. Somebody take their back. You're not supposed to do that in any case. Most of our people like to wipe our nose and dig our nose. So the virus goes from the hand to the nose. It goes into the respiratory system, start at the throat. It gives you what? Sore throat. The first thing you get is sore throat. After, there are 3 types of thing you get, which is sore throat, and you get fever, and after the fever, the sore throat, what do you get? You get a pneumonia. There are 3 things you get. Fever, first of all, you get a dry cough. That's the first thing, you get a dry cough. So anyone who's coughing, watch them. dry cough, then you get a fever, and the fever, then you go into your lungs. You know where the SARS went straight forward. It didn't go to your pancreas or to your liver or to your kidney or to your brain, but it goes to your lungs. All these bacteria and viruses that is coming from this place, the coronavirus goes straight to your lungs. And there in the lungs, if you're strong or your immune system is good, you can still fight it. You can still fight it. But if you're not strong and your immune system is down, and it goes to the lung and the pneumonia is formed, you know what happens then? It takes over the whole lung. It takes over the inflammation takes over the whole lung, and it's called in medical parlance something called ARDS, acute respiratory distress syndrome. That happens. You know, you've heard where young people die from flu? Influenza have killed young people. This is what happens to them. Unfortunately, they get this acute respiratory distress syndrome, then they go on a ventilator. You know ventilator? They take their breathes for you. And there's not enough ventilators in Canada or America if everybody gets this problem. Something to think about. And when it goes there and it infects the lung, if you're lucky, you can get out from it. So you can be tested for coronavirus and be positive. You got me? You can be positive for coronavirus, yet you are not sick. Yet you are not sick. And these masks that people wear is stupid, because you should not wear masks if you're healthy. All you do is cause more sweating around your face. You look like an idiot. And but masks should be worn by people who has the coronavirus. The mask will not prevent you from getting it, because when it comes in your hands, you wipe your nose, whatever it may be. There it goes. So, to prevent us from getting coronavirus, one thing we must do: wash, wash, wash. You must wash your hands for 20 seconds every time. You come to this temple, you go out, wash your hand for 20 seconds. Because you don't know who here is a carrier. We're not many here, and that is what we want. We don't want many people to be here today because of this problem. You wash your hand, you wash your hand, and you wash your hand. If you're a smoker, any time is a good time to stop, but this is the best time to stop. So the coronavirus, it infects the cells. And what is difficult about the coronavirus? It's so difficult to track. If you tell people, go into self-quarantine, people are social animals. They do not like to go into quarantine. And because they don't like to go into quarantine, they would not go for the, what? The test. Because the test is positive, you have to go into quarantine. So you don't go for the test, because you don't want to go into quarantine. You want to walk around and spread it around. So these are the main things of the coronavirus. And this, as I said, is not the first coronavirus. It's not the last coronavirus. There are more because of what we are doing to the world. And I haven't heard anyone talking about that. I haven't heard if anybody talked about it on television. Maybe you all have heard, but I have not heard anyone criticizing what we are doing to planet Earth. And that's why we're having all these things. We are destroying the Earth, and because we are destroying the Earth and destroying the ecology, the rivers, the trees, more of these things are going to happen to us. So, to prevent us from contracting the coronavirus, please, wash your hand, wash your hand, wash your hand. Every moment. You don't have to be stupid about it. You know, some people are compulsively stupid. They wash their hand now, they wash their hands. Look what you're doing. If you hold the rails on the steps, wash your hand. You go anywhere, you put your hand something straight, wash your hand. This is the mantra for this disease. Otherwise, we will be in trouble. And we try not to assemble near to people. It's called what? Social? What? Social distancing. Social distancing. Don't let people touch you too much. Very dangerous. So, and this is, once we realize that we can prevent this thing, if we are not in crowds, try to avoid crowds. I don't know how the supermarkets are these days, but if they are crowded, then you know what you should do? Fast. When you fast, you improve your immune system. Fasting improves your immune system, and fasting causes what is known as autophagy. I spoke to you all about autophagy before. Autophagy is where the cells, which are dying cells, which have bacteria, the cells themselves clean themselves. You got me? Instead of the bacteria coming out into the bloodstream, the cells, because of fasting, it cleans itself. So if your supermarkets have a lot of people, your job is to fast. And when you fast, you can save some money. You can increase your immune system. Look how many things you can get. Increase your immune system, increase autophagy. All these things are good for coronavirus.